you're good.
Just get that chair.
Well, he's got stuff in that chair.
So anyways, feel free to move with, and again, more importantly, Harrison is going to talk about kidney diseases. If you don't have a handout and you want one, feel free to let me know. And lastly, before I turn it over to Harrison, if you have questions, if you can't hear him, because for some reason, whatever, he starts to slow down and get really, really quiet. Or he speaks too fast, that's probably more me than him. Feel free to ask him questions as they come up, or wave at him, tell him he's too soft-spoken, throw something at him. Not really, just kidding. But I'm going to turn it over to Harrison. Harrison, it is all you.
Thank you very much. So, as Dr. Casey Baldwin had mentioned, my name is Harrison. I am a fourth-year student at Campbell University's Pharmacy School, as is Cesar, my classmate. And I'm assuming that all of you have had the opportunity to grab one of these handouts here that says Kidney Health at the top. So I want to talk a bit about the kidneys, why they're important, and a bit about disease state management and prevention. Now the kidneys are they're an important organ, but we don't think about them often at least for me, when it comes to the most important organs that we need to function. You know, the heart, the brain, the lungs, the liver, those are kind of the ones who are at the forefront of our health, and we always think about going to our cardiologist or, you know, going to an endocrinologist for liver concerns, things like that. But the kidneys are kind of the organs that work behind the scenes, so to speak. They do a lot of work that the other organs depend on. So before I go down to the kidney functions, what can you all tell me about what the kidneys do for your body? Why are your kidneys important?
You can live with one kidney too.
Yeah, absolutely. We have two for a reason. We can live with one.
I don't know. Let me see. I thought I heard something about, does it cleanse the blood or something? You tell me.
Absolutely,
I think that's what
it
I
does.
heard,
Like a filter system.
Exactly. I'm going to combine those two responses together. So the kidneys function as a way to filter out our toxins.
Yeah. Okay.
Yeah, so very good. So that's under kidney functions, that's the very first point I have, is it excretes waste and toxins from our body. And so the kidneys, which we have situated back here underneath our rib cage, one on each side of the spine, is where the blood filters into, and the toxins go from the kidneys into the bladder, concentrating in the urine. So imagine you have like a sieve, or you have a meshwork. You have something where you're trying to filter out, or let's say you're looking for gold. You've got a sieve that you're trying to work through to find gold amongst a bunch of rocks. So that's how our kidneys work. You've got the water that's passing through, and the filters are going to catch some of the things, and some of the other things are going to fall out. So those toxins are going to fall out from the blood into the urine, so that when it concentrates here and we pee, we urinate, those toxins finally leave the body. And so that's the number one function of our kidneys. And we can function with just one, as you had said. But there are other things that, as I said before, the kidneys kind of work behind the scenes. There's a lot of things that the kidneys do that we don't often think about, but they come up when we have kidney issues or poor kidney health. So going hand in hand with excreting waste out of the body, kidneys also regulate our fluids and our electrolyte levels. What are electrolytes? What are examples of electrolytes?
What is that? When you lose, I guess when you lose a lot from sweating.
Dehydrated.
Sugar, yeah.
Replenishes your something.
So we do lose electrolytes when we sweat. That's true. I heard sugar, so that's close. So when you hear the term electrolytes, think about salts. Think about sodium and potassium and magnesium, chloride. Those are electrolytes. So things that let's say with Gatorade. Gatorade is intended to replenish our bodies with electrolytes we lose. So if you look on a nutrition label, there's all of those, like sodium, potassium, magnesium. You'll see a list of all of these different elements that our body needs that naturally occur in our fluids that we lose, especially if we're dehydrated. And so the kidneys function to regulate these levels. If we have low sodium, the kidneys will hold on to more so that it helps to raise our sodium. Or vice versa, if we have high sodium, high potassium or something like that, it'll recognize that and it'll filter out more. So the kidneys work to keep a balance of electrolytes. There's a couple other things as well. So hormones. Hormones in a nutshell are messengers. So a lot of organs in our body produce these signals that send them from one place in the body to another. So, for example, our thyroid is a very important organ that produces thyroid hormone. And what that does is it signals to the body for growth, for example. And it'll send a hormone to all over, especially let's take kids for example, kids who are growing. They have a lot of this growth hormone, a lot of thyroid hormone. It'll signal to the body that it needs to start growing, it needs to start expanding. What kidneys do is they produce multiple hormones, but we'll talk about two in particular. And before I bring up the first hormone, have you all heard about, or maybe even, don't tell me if you take the medications, but some of you all may have heard or take something like lisinopril or losartan or something like that for blood pressure. What those medications do is they act on this hormone called renin. So what renin does, kidneys secrete renin to raise our blood pressure. When our blood pressure is too high, we want to stop that signal. We want to stop that hormone. Because that hormone will signal to the rest of the body to crank up our blood pressure, which we don't want in most cases. And we'll get to that in a little bit when we talk about kidney disease. Another hormone that's really important is something called erythropoietin or EPO. What this does is it signals our body to produce red blood cells. If we're low on oxygen, our kidneys will recognize it and they'll send a message to the bones, because I don't know if you all knew this, but our bones, our bone marrow, they produce red blood cells. Our kidneys will send a message to our bones to produce more red blood cells. It's kind of fascinating just how these messenger signals come all over our body from one to another to signal these things. So it's kind of complicated, but it's very important that we have good kidney health so that these hormones, these messengers, function as they should. The last thing that we'll talk about before we move on to the next section, and remember if you have any questions, please feel free to interrupt. But our kidneys are important for vitamin D. So what do you think of when you hear vitamin D? What is vitamin D important for?
Bones.
Our bones, yeah. Vitamin D and calcium are both very important when it comes to our bone health. What kidneys do is they activate vitamin D, because when we take vitamin D in, it's not normally going to work until it's activated. So like turning on a car. You've got a car, you can't do anything with it until you turn it on, until you activate it, you ignite it. What our kidneys do is they take vitamin D and they activate it. They metabolize it. So they change it from one form and they tweak it, or they turn it on so that our bodies can use it, so that our bones can use it. Which is not something that we think about very often, if at all. So, and that's just a small list of the most important things. That list is pretty massive if we were to actually look at every little thing that the kidneys do. They're the workhorses of our body, and they do a lot for everything, for all of our organs. So I've done a lot of talking about that. We're gonna take this information and we're gonna talk about what happens when we age, what happens when our kidneys start to wear down. A lot of these functions are going to also go down. And it's gonna be important to prevent those and manage those if we're experiencing some of these issues with the kidneys. So any questions about kidney functions at all before I move on? All right. So kidney disease. So I'm going to go ahead and read along, and you're welcome to read along with me. This paragraph will go on to the next page as well. Okay, so just like our other organs, it's important to take care of our kidneys to prevent short-term injuries, or in medical terms known as acute kidney injury, and delay long-term disease known as chronic kidney disease. There are other kidney diseases and kidney concerns that go on: kidney stones, drug-induced kidney issues. I'm not going to get into those details. We're going to focus mostly on a really broad, the broad terminology, which is chronic kidney disease. So for the most part, chronic kidney disease is a silent disease because symptoms aren't normally felt until it has progressed to a later stage of severity and you start to get symptoms. So high blood pressure and diabetes and high cholesterol are other examples of that. You can't tell when your body has high blood pressure normally, or when you have high blood sugar normally, until it's at a really, really, really high level, and then you start to feel sick. So chronic kidney disease is the exact same way. Your kidney function might be going down, but you might feel just fine. So it's really tough to know if you're experiencing it unless you go to the doctor and they take samples of your blood and your urine, which we're going to get to. And as I said here, the next line, the primary way to examine your kidney health is to meet with a primary care provider, to meet with your doctor, to get an analysis of your blood and urine samples. And on the next page, which can reveal the status of your kidney's filtration capacity. So remember when we talked about filtration, you start with your blood, you go through the filter, and then into the urine. So if you want to check how well this filter is working, you want to check what's in the blood and what's in the urine, so you can know if your filter, your kidneys are working correctly in filtering out the correct things, the correct toxins. There's a few things here about creatinine, nitrogen, and albumin, but I think for the sake of this presentation, I'm gonna skip this part. And if you have questions about it or are familiar with what creatinine and albumin are, we could talk about that at some other point after the presentation. Because I want to keep this simple, I want to keep this straightforward for you all. But the point being, checking your blood and checking your urine can help determine if your kidneys are functioning okay. So what are the risk factors? And this is a very important point. Inevitably, our kidneys gradually lose their function the more we age. For some, this may occur faster depending on various risk factors. When considering prevention of kidney disease, there are two main risk factors that contribute to 75% of all cases of chronic kidney disease. And I actually already mentioned these because there are two other silent disease states: diabetes and high blood pressure. So out of all people who experience chronic kidney disease, 3 out of every 4 of these people have either at least diabetes and or high blood pressure. So in your own personal health, if you're experiencing one of these things, then this is something to consider. And we're going, as we read on, if this is something that affects you, this would definitely be something to consider holding on to so you can review it and know what you can do to help prevent the onset or the progression of chronic kidney disease. And so we can help keep your kidneys as healthy as possible. There's a list of other risk factors there as well. So your body weight, whether you smoke or not, those things can also affect your kidney health. And so these along with managing diabetes and high blood pressure are things you can control, things that you can do make changes to improve your kidney health. But then there's other things that you probably can't control. So if you have a family history of kidney disease, if there's somebody in your family, a blood relative who has experienced this, you may be more likely to experience this as well. Some autoimmune diseases, history or frequent urinary tract infections and kidney stones, cancer and exposure to certain drugs. So, excuse me, a lot of these things can contribute to kidney disease. Let's turn to the next page and we'll go over disease prevention. Let me get some water real quick. Excuse me. Any questions before we talk about disease prevention? All right. So we're halfway through this already. So sorry if I'm long-winded. We'll get through this. So let's talk about disease prevention. So as in with a lot of other healthcare concerns, the best approach to your health is to prevent something before it happens. So you want to do what you can to prevent something like a heart attack or a stroke before it happens. You can, obviously, if that has happened, you can manage it afterwards, but it is much better if you can do what you can now to prevent something from happening rather than something actually happening and treating it after. So what can you do to prevent? One important thing that I have bolded is kidney damage is not reversible. So again, you are born with 2 kidneys, but both of them can deteriorate with time, and when damage happens to one or both, the kidneys can't heal themselves. That damage is permanent, and things can only worsen for your kidneys, not get better. You can only help to maintain whatever condition your kidneys are in, and try to make things last as long as possible. So that's why it's really important to be proactive, to act now, to think about your kidneys now, and think about what you can do, what's a step you can take today to better improve the health of your kidneys. So here's a list of some things. So, and some of these most of this is not new information. Most of this you've heard from healthcare providers throughout your entire lives. So there's no secret surprises here. So increasing physical activity and making healthy food choices. So that's always going to help, no matter what. That's going to help with all your organs. That's going to help with your physical health, your mental health. The things that you choose to do to improve your physical activity and your diet choices will always make a positive impact on your health. In particular, when it comes to healthy food choices for your kidneys, and this is kind of like your heart as well, you've probably heard this, but for your kidneys, it's important to limit your sodium consumption, or salt. So ideally you want to be below 2,000 milligrams a day. And I know that's not something that really anybody thinks about. I don't think about it every day. I don't think about it very often. But if you look on a nutrition label, it'll tell you how many milligrams of sodium are in that product. And those things can add up quickly, especially if you're eating something that's processed, something that comes prepackaged. There's usually more sodium than you would have in, let's say, your produce, or anything that's fresh, or something that you make yourself. So limiting it to less than 2,000 milligrams a day is going to be good for your kidney health. Other things, so I had mentioned, not smoking, or trying to quit smoking, and also limiting your alcohol intake to 1 serving a day. And for men, there's more flexibility because you can metabolize alcohol better. So 2 servings a day tops for men, which is usually 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of liquor. So again, this is not news. This is not a surprise. But doing all these things will help improve your kidney health overall. There's one very interesting thing, though. In particular, if you feel like you may be at risk for kidney concerns, is when it comes to medications or supplements you buy over the counter. So you go to your pharmacy or even a grocery store to the medicine aisle. You can buy all sorts of things: Tylenol, Advil for pain, allergy medications, cough medications, antacids. So many things you can buy over the counter without a prescription. But for a lot of these medications, they might have a negative impact long term on your kidneys. One of the things is your pain medication. So Advil and Motrin, or generic ibuprofen, Aleve, or which is a generic. Hold on. Hang on. I just had a brain fart. 1 second. Aleve is naproxen. Naproxen. Sorry. So naproxen, ibuprofen. These things are really good at pain relief and anti-inflammation. But if you have kidney concerns, these can actually make things more complicated. And I won't get into the details as to why that is, but if you are looking for something over the counter for pain, it's important to talk to the pharmacist first, or to talk to another healthcare provider so they can give you advice on what you should take, what you should not take, or how much to take of something, so that you can minimize wear and tear in your kidneys. So that's probably the most important part that I would want you to take out of preventing kidney disease. So, but sometimes this might not be enough. Doing these lifestyle changes might not be enough to help improve things. So, remember we talked about the two biggest risk factors? The 75% of chronic kidney disease cases are impacted by diabetes and high blood pressure. So when you have high blood sugar and high blood pressure, that makes your kidneys work harder. So if you aren't doing what you should to, not just for diet and exercise, but taking medications that your doctors have provided to help reduce your blood sugar or your blood pressure, then your kidneys have to work extra hard to try to to try to minimize that blood pressure and to try to get rid of sugars. So it causes your kidneys to wear down more than they normally would. So the biggest thing to take out of that is taking control of your diabetes and high blood pressure, trying to keep them at goal, whatever your doctor has recommended, taking medications, making lifestyle changes to keep them under control. Because if you can control those, then your risk for kidney issues also goes down. So these are very important things, and they're all interconnected like that. And they're not, again, like I said, they're all pretty simple. They're all pretty straightforward. Okay, before we move on to the last section, any questions on what we've talked about so far?
Well, what is the liver combined with the kidney function? I thought the liver was part of the puration of chemicals that come into the body.
So I'm glad you brought that up. So the liver does do that as well. The liver has similar functions to what the kidneys do. So the liver, what it does is a very important process called metabolism. So there are certain natural chemicals in your body, and there's chemicals that you take in through medicine, through food, that your liver, what it'll do is as the blood passes through the liver, it will take things, break them down into smaller pieces, or change them in some way, so that once it passes through the kidneys can excrete it out. So a lot of medications, actually the biggest one is Tylenol. Tylenol is highly dependent on the liver to be broken down. That's why there's a certain cap to how much Tylenol you should take every day, because your liver can only break down so much Tylenol within a certain time period. So your liver will break it down, but then you still have the broken down products and it has to go somewhere. It's not suddenly out of the body. Some things can go out through the gut, through the GI tract. When you poop, some of the things go out with that. But a lot of the stuff, most of the stuff goes out through the urine after it's broken down. So they do work hand in hand. So does that answer your question? Or did you? Okay.
They both have a function of filtration.
Exactly. They both have a function of filtration. Yeah. So that's a very good point that you brought up. All right. Yeah, go ahead.
Diabetes, what manufactures, I think, is a substance to keep the amount of sugar going into the blood vessels that we have to be controlling in our way of, again, eating. So what do we look for when we do have diabetes affecting our organs?
Okay, so to understand, just so I can get a clarification on your question. So you're asking about diabetes and what can we do to help protect our organs when we have diabetes? Okay, so like I was saying, so with diet and exercise, that can help kind of reduce, because the biggest concern is too much sugars in your blood, right? When you have too much sugar in your blood, that can cause a lot of complications. So the goal is to try to get those levels down, or keep them down, if possible. So, and it gets complicated when it comes to what exactly that causes, what exactly that will do to each organ, but it affects a lot of our organs, not just the kidneys, but things like your limbs, your blood vessels. You get neuropathy. It affects your heart. It affects your nerves. So doing the diet and exercise to keep things down, and also taking the recommended medications if you have diabetes, so that your A1C, which is your average blood sugar, goes down. Something, if you have diabetes, you normally would want to go to the doctor every 3 months to get blood drawn to see what those levels are, and then they can kind of determine, do you need to add something, change something, or are you good to go? So with other than diet and exercise, getting frequent follow-ups with your doctor to make sure that your blood sugars are good every 3 months is the best way to maintain and manage diabetes. That's probably the best term, is to manage diabetes. If you can manage diabetes, then you can prevent or manage kidney disease as well, and also any other concerns that you have.
What do they consider borderline to be a diabetic?
So that's a good question. I see you saying that.
Do you know how to answer that?
So like pre-diabetes, is
Are
that what
you
you're gonna do?
talking pre-diabetes? The most easy way, and that's poor English, the best way that we get diagnosed with pre-diabetes is when we do your blood sugar sticks. If your physician looks at not just your blood sugar, but it is that moment in time, they can also do blood work, and they'll look at something called an A1C, or hemoglobin A1C. That tells us what your average blood sugar is over the past 3 months, with a closer focus on the last month. Your A1C to be in the pre-diabetes range is 5.6 to 6.4%. If it's above 6.4, so 6.5%, that says you have diabetes. That's one way people get diagnosed. The other way people get diagnosed with diabetes is we go in, they do your finger sticks, and your blood sugar is above 126 or 125.
That's high.
Yes, that's high. Your fasting should be below 100 if you don't have any issues with sugar. Some people will get diagnosed because they do a random blood stick and it is above 200. So there's a variety of ways we get diagnosed with diabetes, but it absolutely damages your kidneys.
So much sugar you lose a finger or toe.
Or toes, or eyes, or your heart, or parts of your brain, or parts of your colon. You know, it's fun.
That's when you start taking the shots and all the other
That's-
stuff.
That's when
right,
you should
yeah.
manage it.
That's
And
right.
if that's something that you all are interested in, I say I, but the learner next month and I will be more than happy to have a presentation about diabetes, if that would be of interest.
But
I mean,
excellent, thank you. Those are excellent questions.
Yeah.
So, and that brings up, that definitely, with healthcare, everything is interrelated. So right now, the presentation here talks about kidneys, but the kidneys impacts everything. So we're talking about, we go from kidneys to diabetes. Diabetes impacts everything. So everything is interconnected. So a lot of the ways that we manage things are very consistent. The diet and exercise, going to the doctor frequently, getting a checkup, and making sure that all of our organs are functioning the way we should, and make sure our lab levels are where they should be at. So,
Make sure you're alive.
yeah, exactly. So, and to add to that point, to kind of carry home why that's important. Our bodies need sugar. Every single organ, every single cell in our body needs glucose to function. And there's supposed to be a certain level of glucose or a range that our bodies need to maintain. Because not having enough glucose, you feel tired, you feel jittery, and your body can't function because it's not getting the energy it needs. Every single second, every waking moment, and even every sleeping moment, our bodies are using energy in some way. And the source of energy is glucose. So if we have too much, if that level's too high, that's going to negatively impact everything. Because our body can't use all the energy, so our body either has to store it somewhere, or it's going to affect other organs in ways that they normally shouldn't. Hence why we're talking about the kidneys and why diabetes can impact it, because too much sugar is trying to get filtered into your kidneys here. That's going to damage them because your kidneys can only take so much sugar movement through the kidneys, and so that's going to cause damage. So that's why, if you want to, yeah, go ahead.
That gives an example of when I gave up all sugars when I was in high school, because we're talking about what is going to be your New Year's Eve or your New Year resolution.
Right.
I took the sugar out of salt. I mean, out of not eating cake. No soda, no nothing. And when I went out there and played basketball, I fell out. I had no sugar in my sugar.
You had no sugars. That was a shock to your body. You didn't have the energy, right?
No energy.
So that's why there's a certain balance. You know, and I think you had a good goal in mind, right? You're trying to cut out all your added sugars.
Yeah,
but I think that might have been too much of a drop in your blood sugar, right? So.
But you'd be surprised how many people have diabetes.
Yeah.
I mean, it's like,
Oh yeah, like I said, it's a silent disease. You can't tell.
No.
If you don't follow up with your doctor, you might not have symptoms, but you might have high blood sugar, and not know it. You can live with it for years and years, and that might cause kidney issues over years as well, with you not feeling a single thing. That's why it's important to follow up with your doctor frequently, so you can get that. Now, if you don't have diabetes, going once a year is usually good enough to get your blood checked. But if you do have high blood sugar, going more frequently will help to manage that. So, excellent points, excellent questions. I appreciate the discussion we're getting here. This is good. So, we'll move on to the last part, which is disease management. So, before we read this, and on page 4, there's a list of several things. I want to clarify that this is an educational piece. What I'm here as a pharmacy student is to teach and inform, not to give specific medical advice, especially when it comes to complicated disease management. So we're going to go over some things that are for your information and not something that I'm telling you to go and self-treat. If you have concerns, if you feel like you may be at risk for chronic kidney disease, or you already have it, it's important to talk to your doctor to get specific advice on and potentially get prescriptions so that you can manage your disease the way that's individual, because that's how diseases are. They're very individual. Not one treatment and one medication is not going to work for every single person. So take that with a grain of salt, no pun intended there, in regards to the information I'm going to provide you here on the next page. So, if you recall at the very beginning of this discussion, I talked about what some of the major functions of the kidneys are. We talked about filtering electrolytes, we talked about the hormone signaling, renin for high blood pressure, erythropoietin for messaging to the bones to make red blood cells, and for the metabolism or the activation of vitamin D so that our bodies can use it. So with these things, taking into account these complicated things, if our kidneys aren't functioning as well, if they're starting to deteriorate, they're not going to be able to do all of these things as they normally should. So let's go down this list here briefly. So the first is anemia. Does anybody know what that term means? What does anemia mean? I'm sure you've heard of it.
Low blood count.
Mhm. Low blood count. So in particular, we're talking about low red blood cells. So we all have blood. And in our blood vessels, there's plasma, there's white blood cells, red blood cells, platelets, different proteins. There's a lot going through our blood vessels, but red blood cells in particular are what carry oxygen to our body. So if we have a low red blood cell count, that term is anemia. Remember that I mentioned that our kidneys produce a signal to our bones, EPO or erythropoietin, that tells our bone marrow to produce more. If our kidneys are damaged, the ability for our kidneys to send that message isn't going to be as good. So if our kidneys can't signal to the body, hey, we're low on red blood cells, let's make more. But they're unable to do that, or not unable, but they have a lower capacity to do that, then naturally we're not going to have as many red blood cells, and that's going to lead to anemia.
That's when cancer comes in.
That's actually, yeah. So cancer and anemia are very commonly accompanied, and that's that could get complicated. But for the sake of talking about the kidneys are necessary to signal to make red blood cells. If you don't have that function in the kidneys, you can't make it as well. Electrolytes. Remember we talked about some of the electrolytes? So in particular, potassium and phosphorus are regulated by the kidneys, and if they aren't functioning as well, it's not going to signal to our body or it's not going to excrete out as much in the urine as it normally should. So this mismanagement of electrolyte levels is going to cause some concerns. And there's a list of foods here in particular for potassium and for phosphorus that if this is something that is happening to you, if you go to the doctor and they say, hey, your electrolytes for these are very high, they might give you a list of foods that you should either limit or avoid altogether, so that you're not eating too much of these electrolytes because you're not getting them out of your body. There's also medications that you can take that will bind to those electrolytes so that your body doesn't absorb them. For potassium, bananas is probably the most commonly known medication when it comes, or not medication, most common food when it comes to high potassium. So people who often have high potassium will try to avoid bananas so that they're not getting too much into their body.
Where does the thyroid come in?
The thyroid?
Yeah.
So the thyroid, we'll talk about the thyroid here. Let's get to the list and then we can mention the thyroid here. So not disregarding that, but we'll get, because this gets complicated, but then we'll talk about the thyroid because that's also another separate complicated topic we could talk about. So now again, I'm not saying that you need to avoid these foods if you're trying to protect your kidneys. That is not what I'm saying. I'm saying if your electrolytes happen to be high, which you wouldn't know unless you went to the doctor and you had blood drawn or a urine sample, then these are foods that they would recommend that you try to limit. So if you don't have these concerns and you avoid these foods, it's not necessarily going to protect your kidneys. Again, this is just for your information in case you're trying to manage things. The last thing is low vitamin D levels, which again, the kidneys are important to activate it. So if your kidneys aren't functioning, they can't activate vitamin D, so you're not going to have good levels of vitamin D, and that's going to affect your bone health. It's also important if you're dealing with chronic kidney disease, that when you go to your doctor, whoever's specializing in managing your kidney disease, that they have a list of all of your medications. They need to know every single thing you're on. Because some medications, remember we talked about the liver and the kidneys, how those both filter out and break down drugs? Well, if your kidneys aren't functioning as well, the kidneys might not filter out some of the medications. And so some of your drug levels might go up higher and they might get to toxic levels. So that's not all medications. There's a select handful, a select list that your doctor needs to see, or even your pharmacist. Your pharmacist, if you go to them and they know your kidney function, they can also take a look and then speak with your doctor on recommendations on adjusting some of your medications. So this is a very simplified list on how to manage chronic kidney disease. And again, this is not to give you any medical advice. This is just so your information, so you're aware on why our kidneys are important, how to prevent progression of kidney disease, and how to manage it if it's impacting you. So to tie things all together, so that's a way to tie things all together. Kidney damage is not reversible. Managing diabetes and high blood pressure is extremely important to prevent and manage kidney disease. And prevention is the best strategy. So diet, exercise, limiting salt consumption, limiting alcohol, and trying to cut down on smoking and quit smoking. Those are going to be the best things overall to manage your kidneys. I know you mentioned thyroid. We'll get to that in a second. But let's wrap this up. Any questions about what I've talked about? I know some of it can go through one ear, not the other, but it's fascinating and important to know what your kidneys are actively doing right now and what we can do collectively to help protect our kidney health so that we can hold on and keep both of those kidneys for as long as possible. So, thank you. Okay, so before